Hello, good afternoon, and good afternoon or good morning to our West Coast colleagues. I am Stephen Bloom, Assistant Vice President for Government Relations here at the American Council on Education. First, I'd like to thank our co-sponsor of today's webinar, the Association of University and College Counseling Center Directors, AUCCD, and the Jed Foundation, both of whom are terrific partners for our work on student mental health. I'd also like to thank you for joining us on this important conversation. The mental health of college students has been a challenge for many years. The current environment, including anti-DEI and anti-trans actions by federal and state governments, student visa challenges, reductions in research funding, potential cuts to student aid, limits on free speech, and the political vitriol is no doubt having an impact on the mental and emotional well-being of our students every day. Our students are reporting mental health challenges at a really a growing and alarming rate. One data point that kind of confirms this: almost half of students have screened positive for anxiety or depression, while only about the same percentage have received therapy or counseling. In a few minutes, you will hear more about this challenge from a panel of three experts and my colleague, Dr. Holly Chessman. In addition to ACE's programmatic work on this issue, which Holly leads, we're also working to address this issue in our advocacy in two ways. First, we successfully sought an increase in fiscal year 2026 funding for the Garrett Lee Smith Campus Suicide Prevention Grant Program, which is housed at the Department of Health and Human Services, and we're advocating for a further increase in this coming fiscal year. Second, we're pushing Congress to authorize the interstate provision of behavioral health services using telehealth for students enrolled in college. This would provide institutions with another tool, which is increasingly important since the pandemic, to help students experiencing a behavioral health crisis, while also helping to improve retention and graduation rates among affected students. So now let us turn to Dr. Chessman and our panel of experts.
Thank you, Stephen, for that great introduction. And again, a big, huge gratitude to our colleagues at AUCCD, the Association for University College Counseling Center Directors, and our colleagues at the Jed Foundation. I'm really excited to welcome you all here today. I see people from all over. We see people from Washington and Illinois and Virginia and Arkansas. So we've got a lot of different folks joining us from all over the country. I think this is it speaks to the importance of this topic, and no matter where you are located in our great nation. So what I'm going to do now is I'm going to introduce panelists, and then we're going to have a conversation. We're going to give the panelists some opportunity to answer some questions, talk about what a trauma-informed approach is, talk a little bit about why we are where we are at this moment, and also talk a little bit about what we can, as professionals that work in this field, do to take a more trauma-informed approach to things like policy, advocacy, and practice. So without further ado, I would like to introduce our first panelist, Dr. Kimberly S. Gorman. She's the Associate Vice Chancellor for Health and Wellness and the Student Affairs Division at Western Carolina University. She's a licensed psychologist who has worked in higher education for more than 2.5 decades. She has served on the governing board for the Association for University and College Counseling Center Directors and on the advisory board for the Center for Collegiate Mental Health. Her primary research interests are related to collegiate mental health and mental illness stigma in the college population. She has co-authored several papers focused on the impacts of mental illness and its related stigma in college students, and recently co-edited the volume of a university-wide approach to changing campus cultures of mental illness stigma. And she's also a really good expert on trauma-informed practice. So thank you for being here, Dr. Gorman. Our next panelist is Dr. Zainab Okolo. She's a seasoned expert in higher education policy and mental health. She has dedicated over a decade of her career to breaking down barriers for students, enabling them to thrive academically and lead fulfilling lives. She currently serves as the Senior Vice President of Policy, Advocacy, and Government Relations at the Jed Foundation, where she leverages her extensive experience to strengthen the organization's national and state level presence. Dr. Okolo collaborates with external networks to advocate for increased federal, state, and local support for a comprehensive approach to mental health and suicide prevention. As a trauma-informed licensed mental health clinician, Dr. Okolo has provided crucial support to individuals, families, and institutions, emphasizing strategies to overcome stress and anxiety, and has been a wonderful partner with the American Council on Education as we work to address this issue. And finally, Dr. Eric Wood. He is the director of the counseling and mental health at Texas Christian University. He is the past president of the Texas University and College Counseling Center Directors Association and is a current executive board member of the Association for University and College Counseling Center Directors. He writes a weekly column for Forbes in college mental health and emerging adults and has trained over 100 schools on different aspects of mental health. And you can see him in lots of different publications, including the U.S. News and World Report and other national publications. Welcome, Dr. Wood. All right, so Dr. Wood, I'm going to turn it right over to you. So can you talk a little bit about why we are doing this panel by providing some further context for the audience on why we need to be talking about policy, advocacy, and practice as important areas around mental health in this moment?
Yeah, I mean, first of all, thank you for allowing me to be part of this panel. I'm very excited to be here with the Jed Foundation and your organization. And yeah, I mean, this is really important. I mean, especially for, mental health practitioners on campuses. One of the things that we're highlighting, these current cohort of students between the class of 2028 and the class of 2030, they were actually in middle school when the pandemic and everything hit. And if you really think about the developmental lifespan, I mean, that is like a really important time because there's so much change, there's so much identity thing. And that cohort, they're having what we call more adverse childhood experiences. And if you have more of those, that actually causes a lot of stress. So we know that these incoming cohort have these unprecedented challenges. So then is the idea of, well, how do we do that? First, even decades ago, higher education literally made a decision that whatever affects the person affects the learner. And so part of higher education is that we are going to support the whole person. So when people talk about, let's get back to the roots of higher education, well, that means supporting the student as a person. But with the trauma approach, it really is like a roadmap that they got. Saying, this is a way that you can actually support these students, and I think you should use it.
Dr. Wood, we're losing your audio.
Oh, can you hear me now?
Yes.
Okay, I was going to say when you use a trauma-informed approach, it actually really is a map, it's a roadmap of how you can support these students. And you mentioned when I wrote for Forbes, I got access to a lot of information about redefining the enrollment cliff, that now instead of a seller's market, it's a buyer's market. And organizations that thrive in that buyer market are ones that can retain their students. And if you think about students who, leave university, especially for mental health concerns, part of the main reason is coping. Like they don't have the sufficient coping skills. It's not the major crisis that gets them to detach. It's the coping mechanism. Where here you have an approach that's designed to help people cope. But on the other end of the cycle, we do know if there are students in crisis, a lot of times being in trauma is going to be a part of that, like having a history of trauma. So it really helps, address those students as well. And then administrators, yeah, we're really into building a campus community. Well, that's what a trauma from approach is. It's like dealing with the thing as a community. So you have to think about what are the needs of the faculty and the staff. We know that if you have trauma, you might actually hurt someone else because of the coping. And so it's not just how do we serve our faculty and staff, how do we make sure they don't cause distress? But on the flip side of it, if faculty know how to handle in that moment a student who is dealing with trauma and give a response, then that's going to strengthen the community as well. And then I always say, if you ever hear me talk, I think people underestimate the power of higher education. The idea of trauma is not just for higher education, it's affecting a whole society. And I always say, what's the best way to impact society? And we think about the demographic of students that we have. No one has the access as higher education. We have the infrastructure, we have the gatekeeper. So I think it's really time to actually use those opportunities. So in summary, I guess trauma-informed approach, it is a roadmap. It's a guide that's been proven effective, and there's a lot of opportunities that we can take advantage of.
Thank you, Dr. Wood. So Dr. Gorman, Dr. Wood, you did a great job of laying out why we need to be talking about these three distinct areas. Can you provide an explanation for the audience on what actually is a trauma-informed approach and how it would look like in different areas on these campuses?
Yeah, absolutely. And likewise, thank you for inviting me to be a part of this very important conversation. As Eric kind of referred to, our students and our staff are navigating impacts of new traumas. They're navigating the emergence of impacts from older traumas. Just all need to be aware to be able to provide support for our communities. And real quickly, I've heard criticism that the term trauma is being overused, and I would argue that is not the case. If we think about a definition of trauma as something that overwhelms a person's ability to cope, it's deeply distressing or disturbing. That's, I think that definition is what trauma is. And maybe there is just really that much distress in the world and in our lives. And so if ever there was a time for us to be talking about it, now is it. So the principles of trauma-informed care are just the essential groundwork for developing and implementing it in higher education. If you're not familiar with those principles, SAMHSA has offered 6 core principles, and those are safety, and that includes both physical and emotional safety, collaboration, trustworthiness and transparency, empowerment, peer support, and understanding and honoring context. So when we use this framework, I like to think of trauma-informed care as a framework. It really benefits those in our communities, which of course includes not just our students, but our staff as well. And I think we really need to be paying attention to staff in this moment as well. And studies are just really clear that trauma-informed care reduces the risk of re-traumatization. It helps students to stay enrolled and to persist. It enhances emotional safety. It fosters the sense of belongingness. It really empowers students to use their voice, to make choices that are beneficial for them. And they're reinforced for using their voice when this happens. The benefits to faculty and staff also are important to the faculty and staff, maybe have navigated difficult systems in their experiences with higher education. They're at risk for re-traumatization. So using this trauma-informed approach with our staff also kind of helps them to feel that they belong in the areas that they inhabit. And lastly, it just really benefits our counseling center staff, as Eric kind of mentioned. We great risk for burnout for our staff is they're the front line for the students who are coming in to seek support for all the difficulties that they're having. So in this webinar, we're talking about 3 different areas. And I really think the practice area of trauma-informed care may be the easier one to implement, at least at the beginning. We can make changes in our offices to enhance safety for those who enter in. We can be responsible for being transparent by stating what we're going to be doing up front and then doing it, following through on it. And I encourage just really each of us to think of how we can live these principles that I mentioned a little bit earlier. But I want to give you just kind of a couple of examples of ways that we've utilized trauma-informed care on our campus. And I will say it has been a long-term effort. We started our approach in our counseling center 7 years ago, and we're still working on getting that implementation in. It's been a lot of introspection, it's been a lot of reflection, and a lot of willingness to listen to each other. We began by thinking about how we were going to provide care for students because of those ACEs scores that Eric talked about. And so we looked at the physical environment of our offices. Is this a safe place for people to walk into? But since then, we've really been looking at, and we've kind of grown our trauma-informed care approach to take into account how are we training our trainees? What are our policies and practices around that? How are we selecting and hiring staff? What's the onboarding process look like for those folks who are beginning to work in our center. How do we support staff in the daily work that they're doing? What are trauma-informed approaches to that as well? So again, it's been a long process and something that we've been thinking very critically about. When I got into my position as the Associate Vice Chancellor, it gave me a little bit more opportunity to enhance trauma-informed care across the campus. And one of the things that I saw pretty early on was we have a required campus safety training. And that training, of course, involves assisting. It's a required mandated training for all new employees. It includes that run, hide, fight video for an active shooter, a response to an active shooter. And so historically, folks would come into the training not knowing what to expect. And as you can imagine, that was a little jarring to have that video played without any expectation that was going to be there. So we worked with our human resources department to create an email to go out to the employees prior to the training, telling them the why. So there's our transparency. Why are we doing this training? What's going to be the content? And letting them know that the video is a part of that, giving them choice, giving them an option to complete this training in another way if they needed to. So again, just thinking kind of more broadly and critically about how do we support all staff and all of our students across our campus. And I hope this webinar gives you at least some initial kind of thoughts about how to start doing that on your campuses.
Thank you, Dr. Gorman. Dr. Okolo, building off of Dr. Wood and Dr. Gorman's remarks, can you talk to us a little bit about what you're seeing in your work on the Hill and the state level around federal and system policy landscape, and how those who work at institutions might advocate for a trauma-informed approach to developing policy as it relates to the state and federal level?
Absolutely. Thanks so much, Holly. Thank you, Dr. Gorman, for helping us clearly define what we mean by trauma, and Eric, just for flagging all of the different ways in which you framed up the work and how it's showing up on campuses already overall. So on the policy level, increasingly, mental health is no longer being viewed as separate from academic success, retention, workforce readiness, or public health. It is now central to all of those conversations, which for those of us that have been doing this work for a while, this is a huge win. And borrowing from Dr. Sakia Smith Ellis's framing around firefighters and architects, as we think about the new nexus of higher education and the recognition around the growing need for us to not only respond to crisis or harm as it occurs, but also design systems differently at the beginning. So if we are in a time of revolution, this is the time to ensure that mental health is now being understood as a foundational pillar to student success in the same ways in which belonging is foundational to student success, and nobody questions that. We have all the frameworks and the data to really back that notion. And students thrive academically in environments where they do not have to feel psychologically unsafe, where they feel connected and supported and are able to access care. We now have the data to share with that. I think the most recent report that I've seen was the Lumina Gallup State of Higher Education report that reiterated for the third year in a row, mental health is one of the top predictors of student persistence. So at the federal level, there is a growing focus on everything in this area, from prevention and early intervention to telemental health expansion to include behavioral health as it shows up online and with AI as a tool. Our entire suicide prevention infrastructure, and then of course, better data for accountability around student well-being and success, which becomes a little challenging because mental health, although we've done a lot of work across time and across the space around stigma, collecting on that data can still prove itself to be challenging and inconsistent across systems. So there's also an increasing recognition that mental health challenges, beyond directly impacting enrollment and persistence, it then impacts workforce participation. So for following the lifespan of a student, students are not students forever, they enter the workforce. This framing has elevated the issue in important ways to our state legislators and representatives. So at the state level, We're also seeing that this difference is meaningful and targeted in how states choose to approach this work, and how it shows up within how they're hoping to serve constituents. So I'll use a couple of states as an example. For example, in Louisiana, there has been growing investments in statewide behavioral health coordination and partnerships connecting higher education and workforce and public health infrastructure, particularly in rural pocketed areas around underserved and untapped communities. Whereas in Texas, we've also seen major investments in youth mental health infrastructure to include telehealth access and a real focus on peer support. Texas has also become an important example of how philanthropy and state leadership and higher education institutions can collaborate to bring actionable and positive outcomes to scale, as a policy strategy. In New York and even in states like Arizona, we're seeing important work around integrated care models, with public university partnerships and statewide coordination focused on youth suicide prevention and behavioral health access, especially in areas facing provider shortages, which again is nationwide, but you have to have the focus within your state to really target the populations that need that support the most. And so across these examples, one thing is pretty consistent. States are increasingly recognizing mental health policy cannot exist in a silo. It has to connect to educational outcomes and workforce development and community well-being. I think I saw a comment earlier as Dr. Woods was presenting around what about faculty? Exactly. So as we're thinking about students, we're also thinking about student-facing practitioners. How equipped are they to not only identify resources, but to also land and utilize resources themselves? Because they become the real-life translators of those policy opportunities on campus. And if they don't feel confident in it themselves, there's no way students are going to engage with it in the way that we are hoping to in order for them to be retained on campus. I can also think about the growing awareness that policies themselves can either reduce harm, but they can also unintentionally deepen harm by ignoring the roles that systems play in perpetuating trauma. So a trauma-informed approach, using Dr. Gorman's definition, has to ask a couple of different questions, including what is beyond what is wrong with the student, but how can our systems and environments and policies that are impacting students also deliver safety and dignity and trust and belonging? And so this shift is significant and it matters to how we think about policies. So to answer the last part of your question, Holly, for institutions wanting to advocate for trauma-informed policy development, I would encourage a few things. The first, I would center student voice across the expanse of this work and this movement around mental health, more specifically in higher education. Students have exclaimed nothing about us without us. And when we see policies that actually stick and move and actually make the impact that they're intended to make, there's always a student voice, a student experience, a lived experience at the center. And that is how we should start to shape this kind of policy from the ground up. Second, we have to move beyond crisis response. Most of the earlier versions of what we understood to be mental health policy was in response to things like gun violence on campus. And it was always a retroactive response to a crisis that already took place. And so trauma-informed systems invest in upstream prevention, belonging and campus climate and peer connection, both on campus with faculty and staff, considering their capacity, and off campus with being able to triage resources off campus where necessary. And then finally, institutions should be able to and be ready to recognize that advocacy matters and their voice in this work matters so much. So colleges and universities have a tremendous amount of power to engage policymakers within their states, and participate in coalitions, share data and student stories, and advocate for sustained investments in mental health infrastructure and prevention. And all of this work really does work together to ensure that mental health is not peripheral to student success, but it remains foundational to it as we think further around both state and federal policies moving forward.
Thank you for that, Dr. Okolo. I think one of the things that ACE and we're working on as well, and I've had a conversation with Dr. Wood about this, like the trauma-informed sort of approach to policy. And so ACE is working on some going to the Hill to talk to different legislatures about a telehealth bill that would allow teletherapy to occur over state lines based on an exemption that if you're an enrolled college student and you're going to school in Texas, but you live in Louisiana, and you have a provider already, you can go to school in Texas and still maintain that relationship with your provider from Louisiana. And vice versa, if you live in Texas and you've got a relationship and you form a relationship with a college counseling center person and you want to go back home for the summer, you could also maintain that relationship in Louisiana with that college counseling center person. So we're working diligently on the Hill to sort of so that students don't have to come to college. It's already sort of a very unsettling experience, right? And they come to college and then we're asking them to find a new therapist if they're coming from out of state. And sometimes that's just another barrier to care and the continuity of care. And so we're hoping that from that perspective, students are going to be able to sort of really draw upon the current relationships they have with providers, and instead of trying to potentially form new ones or build that trust that is so hard to build within a provider relationship. So thank you, everyone. This has been a great, Aliza just dropped in the telehealth authorization proposal. You can take a look at that document, and we are happy to answer questions about that later as well. One of the other questions I have for you, and one of the things I really try to focus on in our webinars is like advice that you might give to a person that is on a campus, like whether they work in the counseling center, they work in student activities, or they work in, say, the cafeteria, or they work in academic affairs. What is some practice-based advice you might give to campus leaders who would like to take a trauma-informed approach to policy or advocacy or practice? What are some of the like, tangible things that you might advise them to do? And we'll start with whomever would like to begin.
Yeah, I can start. I mean, and I'm also selling some of the comments about resources. And at TC, we actually have a trauma center on our campus, the Caring Purpose Institute, and they do a lot of forming. And I know it sounds biased, but they have a lot of accolades. And I know that that training is not as expensive or cost prohibitive. But to the campus leaders, it really is about the mentality. It's not really about spending a lot of money. It's really about having this mentality. Like I said, higher education, we are in a buyer's market, and there is a term called net receivers, and that is an organization that actually gets more clients, or in this case, more students in that market. And one of the things that makes it is if you have a reputation of supporting your clients, you can retain your clients and you create this sense of community. That's one of the aspects of a net receiver. So even though that's kind of market, that absolutely applies to this, because when you talk about mental health, that is saying trauma is a huge part of that. And if you can actually foster the community, have that mentality, and again, there's a roadmap that already exists. You're not building new programs or spinning things for new offices. You're actually following a roadmap that already exists. And if you strengthen your community, then yeah, you're going to retain your students, all of that. And that includes the faculty, staff, and their own work and things like that. So it's really more about having that mentality and searching and using a roadmap that already exists, as opposed to spending a lot of money trying to do something entirely new.
Yeah, I'll jump in next, order of our speakers, I guess. A couple of things that come to my mind. To start, I would familiarize yourself like deeply with those principles. Like that is the starting point. And it's familiarizing, like, what does this really mean for this work that we're doing, or these responsibilities that I have, or kind of in these spaces that I inhabit with others. And listen, get the feedback. I mean, ask the questions like, am I really trustworthy? Do I do transparency in all things? What if I can't be transparent because of some of the other roles I have? So really kind of doing a comprehensive review of that. And as Eric said, there are resources out there that help you kind of guide through through thinking through those pieces for yourself. The other piece is kind of more of a don't. I would argue this can't be a piecemeal approach, and it can't be done tonight. It is a process. And that's where I think kind of thinking real deeply about those principles and how they exist or don't exist on your campus at all, or kind of in pockets of your campus. That's a starting place. Just because it's a long process doesn't mean you can't do it. But I think just piecemealing it, I fear, will create more harm than it actually than it can benefit others. So those are a couple of things that I think about.
Yeah, I would encourage anybody on a webinar in the future with Dr. Gorman and Dr. Wood not to go last when asked a question. That's my first piece of advice. My next one would be not to treat, kind of echoing what was already shared, not to treat trauma-informed care as a checklist or like a single training that we close the book on once we've decided we've done that. Trauma-informed system reform requires trauma-informed leadership. And we do that by encouraging our leaders to ask questions like, what does it feel to navigate our institutions as a student right now? I was having a conversation earlier with a colleague where, unfortunately, this has happened more times than one, where we've said things like, oh, yeah, I'm what a relief. I don't know what I would do if I was a student in this hour. Bingo. So if you've identified that you would not want, for whatever reason, to be a student in this hour, let's unpack that some more. What's happened in the last 5 years that might directly impact how you're navigating your degree while trying to figure out where to plant all of your learning within the next 4 to 5 to 6 years? And does your institution feel supportive to the needs uniquely of students at this hour, or does it feel confusing or punitive? And practically, you can do this by just, first of all, starting by reviewing your policies. Over the last couple of years, we've seen institutions really take a swing at thinking about policies available to students when they need to step away, updating their mental health crisis policies. So instead of it turning into students looking like they've completely withdrawn, they have a process by which, if they need to take leave or leave of absence, there's a couple of more levers and a couple more opportunities for them. Also looking closely at conduct policies, financial aid appeals, crisis response procedures, if they even exist on your campus. And again, as I said earlier, if you're having a hard time finding those policies, then your students they're not equipped to find anything that you can't directly articulate and secure. And that's a real opportunity. That's not a finger wag at institutions. Remember, where a lot of this conversation is because nationwide and actually globally, there is a reorganizing around how we center this work. And so we all have a lot of work to do before it becomes something that's second nature or standard across the nation. So even if you have a trauma center on your campus, there are still opportunities to grow and to expand. And one of the biggest indicators of trauma-informed institutions is whether or not students can ask for help without fear. Because beyond the data and what the data says and whether or not there's a trauma center, is there a culture on campus where students can go to a warm hand, whether that be at the counseling center or at the cafeteria, where they know that they will have somebody to point them in the right direction? And if not, those are just opportunities that we can fill the gap on.
Thank you. Now thinking about, people who want to read up maybe more on trauma-informed care or look at resources around trauma-informed care, do any of you have any ones that you would sort of point folks to that they could potentially look at? Any, Eric?
Like I said, I'm going to sound biased, but like I said, our trauma center is world renowned. So the Care and Purpose Trauma Institute on our campus, they have their own website. They do a lot of work with educators too, and giving is basically how to give a trauma-informed response. So obviously being at TCU, that would be my first choice. But even if I wasn't at TCU, I would still mention that.
Could you drop that in the chat for folks so they can take a look at it?
Yeah, I have to give me a second, but yeah.
Yeah, perfect. Anybody, Dr. Gorman, Dr. Okolo?
Yeah, I would flag bias, no bias, the Jed Foundation has a fantastic resource center, both for institutions and individuals. I'll also drop that in the chat as well, just to start around having everything from having hard conversations to what trauma-informed care systems really looks like. We've worked across a myriad of different types of institutions as well. So I'll drop it in the chat as a resource.
And I would highlight the Institute on Trauma and Trauma-Informed Care at the University of Buffalo. That was kind of an instrumental resource that we use. And they have a trauma-informed organizational change manual that you can download off of their website. That's super helpful for us as well. I would also, we use the Harrison Fallot book, Using Trauma Theory to Design Service Systems. It's a little bit older, but old things can be really helpful too.
Those of you who are saying, what did they say? I will make sure that we get those into a list where you can click on the links during. We'll have this recording housed on a page, and you'll be able to what the resources that were mentioned, and we'll make sure that you have the resources as well. So if you can't get to the resources today, you can get to them in a couple of days. So thank you all for sharing those really great resources. And so now we're going to turn to you all for questions. I've seen the chat move in. There's lots of good questions that are coming in. And I basically want to sort of, we asked you for questions when you registered for the webinar. So I'm going to take a few of those, but also I want to get to the ones in the chat as well. But what does a policy look like when it is not trauma informed? Like, we're talking about what trauma informed a policy looks like, but what is it, a trauma informed policy when it's not, what is a policy when it's not trauma informed? Anybody want to take a stab at that one?
I can start and just say, one, it's probably not vetted. There's probably just an ideal out there that someone thinks is really good and maybe a pragmatic thing. But the hard question of what is the impact of this, and especially on the lives and the experience of other people, I think that is what's missing. Like, some people will pass some policies and not realizing the experience of it. So I know I'm talking in general, but that's kind of the one thing, is if you don't consider the impact and the experience of it, then it's probably not trauma informed.
Yes, and adding to that, Dr. Woods, when consideration on impact is not made, it ends up accidentally being punitive instead of supportive. It almost feels like an expose where students are told to bare their soul or tell in the context of safety for the campus, but then the student becomes the automatic IP and they feel tagged in without having resources. And that lack of transparency also, or clear translation, because there's so many policies on the books, state, federal systems, institutions that don't have clear translators or implementers. So there's no real way for it to kind of reach ground or make the impact. And I think a good example that I used earlier was leave of absence policies that make it difficult for students to return after mental health crisis. So it's great that you have a leave of absence policy that makes it easier for them to slide off and off board. But what happens when it's time for them to come back and reinstate in classes? Are they closed out? Are they discouraged from coming back? Are there any policies to kind of help them? And then ensuring that when we think about conducting policies that punish distress behaviors without connecting students to supports, earlier conversations around mental health policy on campus, the response from campuses, rightfully so, was around resources. How we are not a hospital. How do we address all of these needs? And sometimes making sure that policy keeps that in mind so that institutions know that perhaps part of our work is to flag, is to evaluate, is to signal that a student is in distress, but it's also part of our work to know what is within a 10-mile radius of our campus, off campus, to get them resources out in the real world and get them connected. That is also trauma-informed policy, but it has to be put to practice.
Okay, we have some great questions coming in the chat. So what would be your top number one recommendation or action a campus leader, say a provost, a president, can take to build a trauma-informed campus? What's the number one recommended action a campus leader can take?
Yeah, I will start, and I would say just a public message. Because I remember during the pandemic, I know because I wrote it, where the leadership actually endorsed that we want to work towards a trauma informed and just value it. And as Kim said, it wasn't like end all be all, we all right now. But the fact that the leadership actually expressed that that was something they valued, I mean, I could feel how that permeated to our clients and to our student body. So even if you don't know what you're doing, but just a statement that that is recognized, acknowledged, and valued, especially from a leadership, I would say that would be the start for me.
Yeah, I agree, Eric. And I would say, if you do that, you have got to follow through. You cannot just do it and just let it go, because there's the harm, right? If you're setting expectations, so there has to be follow through. If you're ready to make that bold statement, that's great, but have in place what that very next step is going to be.
Again, an enviable task. I would just simply say that systems create and shape whether students experience our institutions as places of support and safety and belonging and growth and access, or places to survive, and sometimes traumatically. And so mental health has to, beyond having the very important declarations and very mission-centered focus that this is a place where students of all abilities are welcome and can receive resources if they have any challenges. But we want students to leave not only having the degree, but knowing themselves more. I mean, some of the data that we have to also consider when we're thinking about just traditional aged population students is that for many of them, a good percentage of them, this will be the first time that they have any sort of mental health crisis. It's just what the data tells us. And there should be an expectation that if they're coming to our campuses during that stage, that they shouldn't have any shame around it. And that again is a cultural nuance that we have to be ready to adapt. And trauma-informed leadership and systems care is ultimately about creating that space and reducing harm, restoring dignity, and helping students thrive.
One other thing I would say, kind of an actionable step, is begin the conversations with your constituents. So talk to students, talk to the housekeepers in your building, talk to the staff in your offices, talk to your administration. Like the approach needs to incorporate all voices. I love that we said we kind of center student voices, and that's great, but the other voices are as important as you kind of begin to roll this out.
And Holly, I'll just make a note. Somebody said something in the chat that I think is really powerful. Advocacy is an action verb. So it's not just like this is not passion project work at all. This is work that has to go from heart to boardroom, from these conversations to coalitions on campus. And each of us here, although I'm not trying to volunteer our time, are equipped and ready to support those institutions in thinking about that, because sometimes, depending on where you are, you don't know where this work should live, or you think it just belongs to the counseling center alone. And it really is the work of the full institution, and there's ways to approach it that way.
Thank you. And I did see a comment come in about how do we do this when we have a lack of counselors? I just want to emphasize that point. When you're a trauma-informed campus, everybody has a responsibility and takes responsibility for that mental health care. And I won't say that the needs decrease, but students have so many avenues where they feel that they belong, where they feel safe, where they have those connections that can offset at least some of the heft of that from the counseling center. Because then the counseling center staff have others on campus that they too can rely on to help do the work.
And I just want to comment about the budgets, because people talk, it really is a matter of priority. Again, it doesn't require that you spend a lot of money, But one thing that's very interesting, like if you know, I talk about net receivers, and that's kind of my thing right now. But if you look at the list of schools who have been recognized for their student support, whether that be mental health or campus support, there are actually a huge amount of the net receivers are going on right now. It's not so much like the size of the schools or anything back. It's just the focus on student support. So if you were to do kind of your own little study and look at the schools that are known for student support and see their enrollment, especially in the last couple of years. And you'll see all different types. It's not just the big schools with a lot of money, but the people who are qualifying are net receivers. That is a theme that's coming out, is that they focus on student support. That is definitely an emerging thing for sure.
Could you define what you mean by net receivers?
So again, this is my time. Is just when during this time, like the enrollment cliff, right, and everything is dropping. These are actually schools that are gaining more. You know, they are predictable. Like some people think if you're a large flagship school, you'll just automatically be a net receiver, or if you're an elite private school, you'll be a net receiver. That was but what we're seeing, there's trends where schools that don't fit that profile are becoming net receivers even during this time. And the one thing that's emerging is the focus on student support. It's true that that's actually more important to families now than academic reputation, or it's becoming more important.
And that could come in the form of trauma-informed policies and practice. Yeah.
Yeah, because it's basically a community of care. That's basically what you're focusing on.
Exactly. And then it doesn't just reside in the counseling center. It's like embedded across academic affairs, student affairs, housekeeping, groundskeepers, anybody who has in contact with students on a campus. So what is your take on AI for support aspects related to this? Is it seen as a bit of a threat that is making it worse for students? And maybe how might we leverage it for a trauma-informed approach to helping and support our students?
Well, that's all the time we have today, ladies.
Yeah, I was gonna say it's a whole nother webinar. I would say all the above. You know, I mean, there are definitely useful ways and people are using them more, but there are a lot of risk factors that people aren't really aware of, like when AI goes into psychosis and hallucinations and all those type of things. So I would just say all the above.
I would say that as well, Holly. I think the one thing we have to understand is the example I like to use, but it ages me, I don't care. AI is like our new, like the new email, like the new fax machine. When these things came out, it was like create the policies that shut it down. We need to be writing letters by hand and moving through the world at that pace. And AI is here now. But one thing about AI that we have to understand is that some folks would argue that calling it intelligence is misleading, particularly to youth, because these are large language models. They're not inherently intelligent in the ways that we understand intelligence. Additionally, there is so much that we do not know. So we have a lot of free reigning access right now because the language models are learning how we learn, how we think, how we behave. So a lot of the infrastructure and policy conversations around AI right now is around how do we ensure that we do not limit students from growing into the world that they have right now without it causing harm, because essentially it is a free radical. Thinking about AI as a replacement for licensed clinicians and actual professionals in the mental health space, I think is extremely dangerous. There are low-hanging fruit ways that we can utilize AI as a resource, i.e. through like initial evaluation, but beyond that, there's so much within nuance that these platforms don't have down quite yet. I'm not in tech. I'm not a woman in tech. I don't know if it will ever grow to that, but these are some of the concerns that we're already seeing, especially as parents are thinking about ways to, again, keep their students on path without keeping them away from the evolving world. We just have to remember that this trusted technology that we've all come to know is on this is the opening credits. So trusting it to solve some of these issues is beyond the scope of what it's built to do right now.
One of the it's a great question, and oof, like I think we said a whole nother webinar. But one of the things I draw back to, I always lean back to the principles, y'all. When you're asking all these questions, I'm just always thinking about these principles of trauma-informed care. Like where do I lean back to them to help me kind of navigate through this? And that one about understanding culture and context. I think with an AI approach, that's where the danger for me is, because how is that going to happen? The human being sitting in front of me, um, having that kind of conversation together helps me in my approach to understand the context of this human being, kind of their strengths, the traditions that they've used, or kind of the ways that they have healed themselves and how they feel themselves in their communities. And that's such an important part of kind of the work for me, that it's hard to detach. It would be hard to detach from those principles with an AI approach, I think is what I'm trying to say. So very great question though. And that's my very feeble attempt at an answer.
And I think it'll continue to evolve as the environment evolves, right? So one of the questions that came up, there was a couple questions about faculty and staff and trauma-informed care for faculty and staff. When you think about, faculty and staff that maybe have experienced trauma on our campuses, what might we think about in terms of support for those faculty and staff as we think about a trauma-informed approach for people who are supporting students that might have also experienced trauma themselves?
I think it goes back to kind of our piece of, the trauma-informed care approach. It really kind of challenges that notion of, I think we said this earlier, like what happened to you, to an understanding of, or I'm sorry, what's wrong with you, to a, hey, what's happened to you? And if we approach everyone as if something has happened to them, we approach this universally using trauma-informed care, that I don't need to know what happened, but I just need to acknowledge that something has happened. And that approach kind of allows us then to interact in safety and transparency and collaboration and empowerment. And so I think kind of just acknowledging it's not just the students, and it is more than that, but that's a first step of saying our faculty and staff carry around with them. Honestly, y'all, well, that's in our counseling center. I said we started focusing on students. We quickly realized there was a lot of trauma that we were holding from our lives and in our community that we had to kind of think about before we could appropriately and maybe helpfully address it in our students. So I think kind of acknowledging it is a huge kind of first step, and then kind of leaning back into the principles in terms of the classroom and in the department and in in the college. So there's those multiple layers and ripple effects to think through with all of this.
Kim, I don't know if you've seen this, but when we do training about how to give a trauma-informed response to faculty and staff, that's usually a catalyst for them to either get support or to learn more about their own issues. Because it's hard to say to the faculty, hey, we're going to offer this about your own trauma. But when it's catch like, this is how you give a trauma-informed response in the moment, if someone's in front of you, that has been like a way to open the door.
And also empowering faculty to recognize what crisis really looks like, because faculty have so much coming at them and so many different forms of excuses and stories coming at them on a daily, giving them some insight as to when to signal, when to hand walk a student to a resource on campus or resource off campus. I think the other piece too is a lot of the framing, and I appreciate the faculty questions, because a lot of the framing in this work has been centered on students. How do we save the students? How do we make sure that they feel comfortable without missing the fact that faculty oftentimes are uncomfortable themselves managing their own mental health? I like to use the example that when COVID was happening, faculty weren't bundled up and on some safe planet unaffected, right? Like they were in a challenging time having to switch to Zoom. Remember, y'all, we weren't really engaging Zoom like this before COVID. Skype was a thing. Remember Skype? We didn't even know how to dial out anyway. So they had a lot of adjustment and a lot more to lose by signaling, hey, I'm struggling myself. So I think there actually has to be an additional movement around destigmatizing mental health just for faculty because of all of the costs associated with what happens when they ask for help as well. And then making those policies transparent and those resources transparent to them on campus as well. The only thing I could liken this to is when we had a rush of food pantries on campus and discovered that most of the time food pantries were also being used by faculty and staff. And what does that mean when faculty and staff are using, should they be shamed for it? Absolutely not. That's the obvious question. And then systemically, how do we ensure that they have enough resources around them altogether? And I think we're still at stage one for that as it relates to faculty and staff.
A great point, Dr. Colo. Before we're at 5 minutes left, and I sort of like to give folks an opportunity on this panel. If the audience that our highly engaged audience, we had over 320 people on this call. If you wanted the audience to walk away with one thing from this webinar, what would it be?
Get familiar with the principles of trauma-informed care.
Yeah, I was kind of echoing that, just more about the mentality and just imagining the possibilities if the whole campus community had those principles. And then even imagine if that was just normative in higher education, the impact that could have on our society.
I guess I would encourage the audience to not be afraid of what you don't know. I think this is a very big topic, and even I think we've done a good job, not to pat ourselves on the back, fellow panelists, of explaining what we mean by trauma-informed care and the impacts on systems. But again, this is evolving work and revolutionary work. So there's always something to engage, and then figuring out how to apply it to the systems that you serve is another set of work and principles. So asking those questions, having those hard conversations, and using your voice at the policy level, I think is really something I hope everyone feels empowered to do as we wrap up our conversation.
And I want to be able to offer some other resources. We have a website where we house a lot of our mental health resources that AUCCD has produced. We have different resources that can help you think about mental health task forces on campus and how you develop those and how to best make those most effective. We have different briefs on how counseling center directors can talk to their senior leaders about the needs that they have around the counseling center support. We have got resources on how to pick a teletherapy provider and what are the questions that you should be asking when you're thinking about picking a teletherapy provider. Those are all available on our website, and they're free, and you can download them and share them broadly. Another thing I would like to mention is we have a blog series on Higher Ed Today. Lots of different mental health authors have written for us. Dr. Wood, Dr. Gorman, and Dr. Okolo are going to collaborate on a piece that we're going to get posted around trauma-informed approaches so that you will have that as a resource for your work as you think about implementing this on your own campus. And we will also keep this community abreast too of the developments we have around some of the advocacy work that we're doing on this teletherapy bill that would potentially help secure support and continuity of care over state lines for students who are enrolled at our colleges and universities. That will help the college and the student, but also help the college counseling center directors and their counseling center in their volume. So thank you, everyone, for taking the time to be with us today. Thank you to our panelists, Dr. Gorman, Dr. Wood, and Dr. Okolo. Thank you, Stephen, for your hosting and kicking us off. And thank you, Aliza and Rebecca, for gathering the questions behind us. And thank you, Julian and Trey, for doing the webinar behind us as well. So thank you, everyone. Thank you, all the participants that came by today. We really appreciate you. And thank you for being with us. And we hope you have a great summer and restful summer, hopefully. Take good care, everyone.